things I've liked most are the very, very simple things that are just so easy to do. And one of the ones that I saw recently that I just thought, you know, that's something is a simple system. This one's called the Hydrant, for just making sure patients in hospital beds can drink the damn water that we give them. You know, the impact of dehydration on patients' wellness is extraordinary. It's extraordinary. We contribute massively to some of our core indicators about death, about outcome, about length of stay, just from whether the water is consumed or not, whether elderly, frail patients are hydrated or not. And I mean, you, like me, will have seen committed, vigorous, caring staff putting the water by the bed, putting the water in the cup, and the patient not able to drink it until the other member of staff comes to clean that away. And it's fantastic to see very, very simple ideas, cheap, easy to implement, tackling the most basic problems. Potentially one of the ideas with the highest return to investment ratio I've ever seen.
The idea for the hydrant came about because I had a pretty serious back operation, and when I came to, I couldn't get a drink because it was over there on the cabinet, and I couldn't reach it. I was flat on my back, so I couldn't reach it, and even if I could have reached it, I probably couldn't have lifted it anyway.
The hydrants were introduced on one of our wards, which was Jupiter wards. We had a great team that were very, very enthusiastic. They realised the importance of hydration for their patients and also promoting their independence as well.
I find it very easy to use. It means I can get a drink when I need it instead of pressing a buzzer for somebody to come and help me have a drink. I was finding the jug very heavy to lift, to pour into a cup or a glass. At least with a hydrant, I can have a drink when I want.
Our plan is to roll out to another 2 wards. We're doing it on a gradual process so that we can make sure that our patients and our staff are introduced it slowly so they understand the principles of it, also encouraging the doctors to be aware of them as well. The patients love it, absolutely fantastic feedback from them. They find it's great because they're more independent. They can see the measurements on the side to see how much they're actually drinking at a time as well, so that's really good.
It's very easy to use. Families have really liked it because they've commented on it and say, oh, what a good idea, you know, it's a wonder that hasn't been thought of years ago and so on. It's very easy to knock over a glass, and we've had that happen before where a patient's done that. They've gone to get up and slipped. Now, with a sports bottle or hydrant, that takes away that problem. And also, it's much easier for the patient to locate it, that they can just pick it up, put it to their mouth if it's the sports bottle, and if it's the hydrant, that's clipped near to their mouth. So it's easy for them to have a drink overnight.
They love the independence, and they find they don't have to ask a nurse. They can reach the water themselves. You can change the tube every day, and it can go in the dishwasher very successfully, so that's really good.
Patients that have been on Jupiter ward previously that have come back in quite quickly, you know, they want one of those hydrants again. So we're getting quite a lot of people come up to the ward asking for it. And so there's a lot of other wards in the hospital that are really keen to use it. They can have a drink when they want. They don't have to wait for the nurses to come round. They've got more independence. Their fluid balance can be looked at better because the measurement's down the side. They don't spill it over themselves. It's really made quite a big difference to a lot of the patients on the ward.
The doctors have also commented on how better our input charts are being kept and how strict they are. Whereas there was differences. Some people were calling a glass of water 150, some people were calling it 200, and what's in a cup, and did they have a mug of tea or did they have a cup of tea? We've been able to put ice into these bottles and other orange juices, whatever they want into them, and they're drinking more from me because it's there all the time. A lot of my patients are elderly patients who continually tell me, I'm too busy to stop me. Even though we check them on hourly routines going round, they won't stop me because they say, oh, you're too busy. So now I go back and they haven't had to wait for the next time I fill the glass of water. And they're showing me how well they've done, and it's actually encouraged them to drink as well. It is a fact that a lot of them that are with us for weeks on end, 6 weeks later, come back dehydrated.
We have to obviously look at the fluid restrictions because then they can see quite clearly how much drink that they've had. With the glasses you can't always tell how much you've actually had to drink, so it's a little easier to actually monitor.
I think that sometimes with patients, if they can't get an adequate amount of water because they can't always access it lots and lots of times during the day, the good things about using the hydrant or the sports bottle is the fact that we could cut out the use of so many drips that we have with normal saline in it and so on to hydrate the patient. That brings its own risks. When you're actually giving somebody something intravenously, you're bringing in more infection to the patient because you're having to cannulate them. And so by using something simple like the water hydrant, and if you're not having the use of drips, then you're going to cut out the risk of infections in that way as well.
A lot of the patients who can't help themselves to a drink and things, it's really reduced their needs for IV fluids and antibiotics.
We hope to reduce the amount of drips that we have to put on patients. One incident was one of the wards actually asked Jupiter Ward if they could have one of the hydrants. They had a patient that came in that they knew was dehydrated, but the patient just couldn't reach his water. So by having the hydrant actually prevented him having a drip up, which is fantastic, and he actually went home the following day.
Some of our patients, for instance, the Parkinson's patients, where they like to have fluid little and often. Again, it's the nurse sometimes can't go back there every few minutes and keep giving them a drink. Well, with this system, they can have little sips, because very often they have the mouth will get dry because of their medications or just because of the way they are with their illness. And it's been really useful for that. So it might not be a fact that we're monitoring their fluid intake, but the fact that they're having little sips of water and they're making them comfortable.
It's very useful for in the night when I need a drink, and especially if my mouth gets dry or if I start coughing.
For patients that live at home, they have carers 4 times a day and no one comes in between that time. If they could give themselves a drink, then that would stop them coming in with recurrent infections, urine infections and dehydration. I think it would probably keep a lot of people at home than have them keep coming back into hospital for treatment of antibiotics and fluids.
It's made me feel more independent because I don't need help having a drink. I can have a drink when I want, and if I only want a little bit, I only have a little bit.
If nursing homes had it, residential homes had it, and people had it at home with their carers, I think you wouldn't get as many frail elderly people coming in with, dehydration, everything like that. I think it really needs to be out there.
We realised the importance of hydration, particularly at home, to prevent things like urinary tract infections, because that will unfortunately bring the patients into hospital. So if we can prevent those, we'll make a huge difference to our patients.
If you can't reach the drink, if you can reach it but you can't lift it, or if you can lift it but you can't hold it, you're going to need somebody to help you get a drink. So where anybody would struggle to get a drink under their own steam, they can now get a drink whenever they want. We've had a study published, and the study was done in an NHS hospital, and really as a result of making sure people are properly hydrated, and the hydrant was simply the delivery mechanism, there was a 20% reduction in length of stay, and there was a 100% reduction in urinary infections.
I actually think that some of our patients who come in dehydrated, and they have, and we've used the tubed hydrant to begin with and then the sports hydrant, and then they go home and 6 weeks later they come in and they're dehydrated. And could we not learn from this and think, hang on a minute?
I can't think of any of the patients I've had on a hydrant that have needed to have IV fluids.
They see it, that at least we're trying. We're trying our very best to make sure our patients get enough to drink.
Patients become more mobile, they can become more independent, and they can go home quicker.
We're the type of ward that likes to try innovations and new ways of doing things and better ways of doing things to improve the care of the patients.
I've loved it.